Nutrition, I think, again, we're looking at total calorie count, we're looking at protein intake. If someone has a tetraplegia and they're independently living and they have a pressure injury, it may be that it's hard for them to actually get out and go grocery shopping. And so maybe they have someone just pick up some, I don't know, fast food on the way home for them. Or maybe they don't have the ability to get up and do a lot of cooking because they feel unwell because they have this infection that's in this chronic background grumbling phase. Maybe they don't want to actually drink more fluids because it means they're going to have to get up and do a transfer and do an intermittent catheterization, and they're just re-injuring that same area with doing their transfers. So I think the challenge with nutrition is looking at the issues of what kind of support do people have in their life. Can they manage the cooking and the shopping on their own? Are there other issues that are going to compromise their ability to actually get all of those resources? And then cost. A lot of times it's, if you're not able to do all the shopping and food prep on your own, and you're on a very fixed budget, it's not like you're going to order Uber Eats in every night. So there are those practical challenges about how you support someone with adequate nutrition. You have someone who comes into your office and they have skin breakdown. What do you do? Because really that's the practicality. So yes, you're going to educate patients of how significant and how potentially serious the skin breakdown may be. This is your opportunity to pull in some of your allied healthcare friends and associates to really further address the root cause issues. So it may be that you pull in your local occupational therapist to do a review of the seating system. So let's say someone has a ROHO cushion, which is an air-villus cushion. Having the confidence that they know how to check the inflation. A lot of times people think, oh, it's an air cushion, I should just pump it up a little bit more. No. Too much, this is Goldilocks. So too little pressure, you bottom out. Too much air in there, high pressure. So even if someone feels like they're going to be safe on an airplane and they take their ROHO cushion with them to protect their skin when they're on a plane, I always think of Pringles cans. What happens when you get to altitude and you open your can of Pringles? It has that big pressure in there. Same thing happens with air cushions on airplanes. So really knowing how to use the equipment that you have, how to maintain it, and beware of cats. Cats break ROHO cushion with their claws. So how you use your equipment is also relevant, and that's where your OTs can also be helpful. If you're looking at spasticity management, maybe someone is getting that friction injury from spasticity. That's where your role comes in and getting to root cause of why spasticity works now, or it might be initiating treatment for spasticity and perhaps a referral to physiotherapy so people learn how to do prolonged passive stretching at home, because you know that you're not going to have a physio be able to go into someone's home and do stretching routines with them every day. It's not ever going to happen in our healthcare system. So again, it's passing on knowledge and information and self-agency for people to be able to manage on their own at home. And then wound care nurses. So in your office, you're not going to have a whole array of the dressing products that you might want to consider. And so for those earlier wound stages, pulling in your local resources really makes sense. What if this is looking more concerning? Like, what do you do then? That's when you may also call on your other physician friends. And it might be a plastic surgeon. So if you have this large area of wound that has necrotic tissue in it, or eschar, or tons of tunneling, and it looks goopy and yuck, it may be that they need a really good debridement. And that is not necessarily something you can do in your office either. And a referral to a plastic surgeon can be critical at really fostering that initial part of wound healing. Because when we're talking about wounds, we want to talk about getting rid of the dead goopy stuff in the wound base, because that really becomes bacteria food. We want to talk about moisture balance. Again, not too wet, not too dry, just right. So many things in life are Goldilocks. And that might be not just those extrinsic sources of moisture, like making sure someone has continence, or maybe they have a rain poncho so that they're not getting our Vancouver wet weather or Prince Rupert wet weather, it's even worse than Prince Rupert, onto seating systems that then are persistently wet and then skin vulnerability. But it's also wound moisture control. So having dressing products that allow for that appropriate wound moisture balance is important, and then bacterial balance. So sometimes even if a wound doesn't look frankly infected, it's on that spectrum between colonization of bacteria and all the way to infection. Just another tip, swabbing a wound can feel a little bit like a why bother because it's going to grow the kitchen sink. So a lot of times if you really are looking at trying to determine if there is a treatable bacteria that is the most likely culprit, it really has to be done after the wound has been cleaned, and then to get a sense of what bacteria may be present. We also have some access to some interdisciplinary wound clinics, and that feels like a necessary luxury, where you have a team in the same room seeing the wound together. And it's really helpful for our physios and occupational therapists to also visualize the wound, because that gives so much information about how they might be able to modify equipment, surfaces, what have you, for fostering healing. Getting patients with wounds to clinics can be difficult. Really, a lot of time the travel to come to see me in clinic can be more dangerous than the benefit that it's worth. That's where video conferencing, Zoom, which is one of the things that I love and I hate about COVID, is that we have Zoom. I really wish I could see you all in person. That would be way more fun. But it's not practical, right? So same thing here. Sometimes it's not practical or helpful or even medically advisable to throw someone into a car for 5 hours to go to a wound clinic. And that even happens with doing wound dressing product changes. So we have people get in their cars, drive for an hour, go sit and wait, get their wound dressed, and then go sit for another hour or two, whatever it is. So again, it's being aware of, are the treatments that we are utilizing doing the benefit that we hope they are, or anticipate they are, or assume they are. So I'm going to get back to the key TED Talk moments here today. Where is a wound? That's going to tell you maybe where its source is. How did it start? Why now? What has changed? And how come it's not getting better? This actually is the key slide for the presentation, in my opinion, today, because it'll be a jumping point to look at not only wound healing, but wound prevention and skin integrity maintenance.